Hi, this is Dr. Christy DeSapri, founding physician of Bone and Body Women's Health. May is Osteoporosis Awareness and Prevention Month, so we have been very busy here at the practice, as we always are, doing DEXAs, preventing and treating osteoporosis. We have an upcoming event also focused on how we can exercise safely and effectively to prevent and treat osteoporosis, which we're really excited about. So it's really important to understand that osteoporosis in the grand scheme of women's health conditions is just very important, especially as we enter the menopause transition and beyond. So the statistics are really staggering that 1 out of 3 women over the age of 50 will sustain an osteoporosis-related fracture in her lifetime. And the number of people that are increased risk for osteoporosis-related fractures is going to double from the year of 2010 to 2050. And that means there's increased risk of things like hip fractures, vertebral fractures, wrist fractures. And so this is just a really common phenomenon that we see, and it doesn't need to occur. We need to be really doing better in our prevention, which means our DEXAs and our screening, talking about calcium, vitamin D exercise, talking about treating osteoporosis and osteopenia so that we prevent the first fracture or even the second fracture. And the statistics, unfortunately, are dismal that 80% of women who have a fracture are not identified as osteoporosis or given options for treatment. We have lots of ways that we can treat osteoporosis. I talk about that all the time, ranging from, again, things like lifestyle, things like calcium and vitamin D, things like nutrition, exercising appropriately, and FDA-approved medications to reduce the risk. A lot of the women I see in my practice have already sustained an osteoporosis-related fracture, and that's why they're coming to Bone and Body Women's Health, for some second, third opinions to discuss osteoporosis therapy. So we want to get ahead of this. And when I look at the statistics on the International Osteoporosis Foundation about the rates of growing fractures and women who are going to be at higher risk for fractures, due to aging, due to the fact that we're living longer, we want to be living stronger as well. So we hope to see you soon.